One of the simplest and most effective methods for patients to monitor the health of the macula is A, the Rorschach test, B, the Amsler grid test, C, the litmus test, or D, the polygraph test. The answer when we come back. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information you need. One of the simplest and most effective methods for patients to monitor the health of the macula is B, the Amsler grid test. In essence, a graph with a black dot in the middle. With normal vision, we're looking at the grid's central black dot. All lines surrounding the black dot will look straight and evenly spaced, with no missing or odd-looking areas. When there is disease affecting the macula, as in macular degeneration, the lines can look bent, distorted, or missing. Continuing now with our investigation into the diseases and afflictions of the eye, here's our reporter, Laura Windsor.
Roger, in addition to macular degeneration, other afflictions of the macula can be macular tears or puckers. We asked Dr. Kent Small to explain why these are different than macular degeneration.
Well, one of the things that gives the retina some structure, so it's not just wet, mushy tissue paper kind of stuff, is the blood vessels in it. And right in the very center of the macula, in the fovea, there are no blood vessels. So that is an inherently weak spot in the retina in everybody. And now why some people get macular holes and others don't is debated. But nonetheless, because of that inherent weak spot, when the jelly pulls on that, it can pull a hole in some people. The symptoms of it are just like they are for macular degeneration. And a lot of people come in thinking they have age-related macular degeneration when what they really have is a macular hole. Those are my happiest patients. Because macular holes, we can actually cure a macular hole. We can't cure macular degeneration. So the symptoms usually are the beginning of a small smudge spot in the center of the vision, usually with a little bit of distortion around it. And with time, as the hole opens up, it slowly grows up to maybe 0.5 millimeter or so. And with that, the bigger the hole gets, the more the vision declines, primarily just the central vision. Again, the peripheral vision stays intact. It's a little more prevalent in women than men, and a little bit more prevalent in people with pre-existing glaucoma. And we think that with the glaucoma, there's a more weakness in that area because there's a layer of retina that's missing. The treatment for macular hole is interesting. It's surgery. It's a vitrectomy with a gas bubble in the eye. And it was fairly new. The first macular hole surgery was probably done around 1990. And prior to then, we had no treatment for it at all. We just kind of pat people on the back and say, well, gee, you know, your vision will probably get down to about 2200, 2400. You'll be legally blind. And it won't get any worse than that because they usually kind of grow up to a certain level and they stop. Well, with macular hole surgery, we basically go into the back of the eye with little needle-like looking instruments, suck and cut out the vitreous jelly. And there's usually a little sheet of scar tissue on the surface of the macula that's contracted and pulled the hole open. And so I think it's very, very important to peel that little membrane, that little sheet of scar tissue. So I peel that scar tissue with some little microscopic forceps, tweezers, and then put a big gas bubble in the eye. And it's really the surface tension of the gas bubble in contact with the hole that closes it. And the success rate is 95+%.
He is the only one that can fix this problem. And I had surgery, and he blocked that hole. Now, many years ago. And I don't wear any glasses anymore, except for reading. And I come here every 6 months. He checks to see if they're still blocked, if the hole is still blocked. And it's been wonderful. It's been a rebirth, really. I mean, what can you do without your eyes?
I can explain you how it's the big difference after staying at home and trying to see everything, and my daughter, my son, or my grandchildren, and after that, after the surgery, I saw perfectly, and I almost cry, and I say to my daughter, she was close to me, I said, "Can you believe it? I can see clear." I can say thank you, God, and thank you, Dr. Small, for that.
We asked Dr. Small how a macular pucker differs from a macular hole.
A macular pucker, also called an epiretinal membrane, is basically a fine sheet of scar tissue on the surface of the macula, and it basically contracts and bunches the retina up and wrinkles it. And the retina and the macula, your film in your camera, so it basically wrinkles your film. Most people, it's so mild that it doesn't cause significant symptoms. But if it gets to the point where it's starting to impair the patient's ability to function, then you start thinking of treating it, which means a surgery. And basically it's another vitrectomy. You go into the back of the eye, remove the vitreous jelly, and with some microscopic tweezers, grasp the edge of this little scar tissue membrane and peel it off the macula. It's again a very highly successful surgery, about 80 to 90% success rate in allowing patients to read 3 smaller lines on the eye chart. It's a 20-minute outpatient procedure. It's well tolerated, very little pain, if any, afterwards. And it's one of our more highly successful surgeries that we do.
Remember, if you see any onset of additional floaters or flashing lights in your eyes, consult your doctor immediately. For the American Health Journal, I'm Laura Windsor.